Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Melissa Duchesne. Thank you so much for calling in this morning, Melissa.
Thank you for having me.
You are welcome. Okay, Melissa, first tell us a little bit about what is a stroke and who do they impact?
Well, there's actually a couple different kinds. So there's ischemic stroke, which make up about 85% of all strokes, and that's a blockage in your brain, so it's blocking the blood flow to your brain. Then there's also hemorrhagic stroke, so that's about 13 to 15% of all strokes, and that is bleeding in your brain. And then there's also TIAs, and those are what most people know as mini strokes. And so those don't cause any lasting damage, and usually they say those last, the symptoms last for less than 24 hours, but actually we see them last even less than that. So the symptoms will go away completely, and you'll never see that on an MRI. There's no damage or anything like that.
So Melissa, can you tell us some of the common signs and symptoms that we should recognize?
Yeah, so we use the acronym BFAST, and so the B we use for balance. So anytime you feel like your balance is a little bit off, maybe you feel like you're walking, maybe you feel like you're going off to one side or the other, you just feel a little dizzy, sometimes people think. The E is for eye, so anything with your eyes. So maybe you're feeling like you see double vision, maybe vision's gone in one of your eyes. So anything with vision. And then the FAST, so F is for face, so the face is unequal, you're not speaking correctly. And then the A is for arm, so arm weakness. So it could also even be your hand. So maybe something's just not right. Maybe you can't write correctly. Just something's not right. We also use like the legs with that. So maybe one of your legs is just weak. Typically it's one side of your body, not usually both. And then the FAST. So the S, we said the speech already, and then T is for time, so calling 911. So you should call 911, not wait around, and come in right away.
So that was my next question. So what should you do if you recognize some of these symptoms in yourself or a loved one? Like one or two symptoms, and what should you do at that point? Call 911 right away?
Yes, absolutely. A lot of people will drive in, or they even wait at home. They think, maybe their arm's numb. They think, oh, maybe my arm just fell asleep, I slept on it wrong. But honestly, they should just come in right away. It's best just to come in, get checked out. Maybe it's not a stroke, we can send them home, but it's best to come in because we can give them medication, but you can only give it within the first 4.5 hours of the onset of your symptoms. And so if you wait at home, then we can't give you the medication, and that medication increases your chance of a better outcome by 30%. They can also do a thrombectomy where they can go in and remove the clot if they see it, and that increases your chances of better outcomes by about 50%.
So Melissa, if someone's a little bit nervous and scared about coming in, they may recognize a symptom, what would you say about why it's so important to act fast?
So it is very important to come in. We at Covenant, and I'm sure at most other hospitals, we keep our COVID patients separate. They come in a different entranceway. Everybody has on a mask. And it's still very important to come in if you think you're having a stroke, because we take it very serious. We take those patients, they're separated from everybody else. You still need to have care. You can't sit at home because things are not going to get better. Even if you think your symptoms are getting a little bit better, we need to find out the cause of that stroke because we don't want you to have a second stroke. Even if it's a TIA, that's really a warning saying you need to find out why you had that because we want to prevent you from having a full-blown stroke.
Now, is there anything else that we haven't covered you think is vital to knowing about signs and symptoms?
You did ask me the first question on who they affect, and honestly, they don't discriminate. It's elderly, the younger patients. It really doesn't matter. I think our average age anymore is 40s, 50s. And it's not to alarm anybody. It's really the big things are just knowing what to watch for and knowing to call 911. That's the two biggest key things I think that they need, the takeaways from this, and to come in and not be afraid.
Okay, know what to look out for and to act fast, act quickly on this.
Absolutely.
Thank you, Melissa, for calling in. We appreciate it.
Yes, no problem. Thank you.
You are welcome. If you'd like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.